Kathy Buccio here, host of the South Florida PBS Health Channel. It's so great to see you and have you. Today we are speaking to Dr. Sandra Doman. She's the owner of Miami Sports Chiropractic and Yoga Center. She is a leading chiropractor, registered yoga teacher, and founder of Miami's first physician-supervised yoga therapy center. She is the creator of Dr. Doman's Guide to Working with Injuries. It's a training program for yoga teachers and has served as orthopedic injuries educator for Equinox South Florida. Dr. Doman has worked with elite athletes, including serving as the on-site chiropractor for the Dwayne Wade University of Miami and Shaquille O'Neal basketball camps. She leads Miami Sports Chiropractic and Yoga Center in Aventura with a satellite facility at Gulfstream Park for professional jockeys. And Dr. Doman is also adjunct faculty at National University of Health Sciences and a sought-after expert for injury prevention and rehabilitation. And guess what? We have her here today on Talk Shop Live. I'm going to bring Dr. Doman in. Dr. Doman, are you with us? Hello, Dr. Doman. Good morning.
Good morning. How are you?
Well, with names like Dwayne Wade, Shaquille O'Neal, I'm really excited to get this conversation kick-started. I mean, this is fantastic, and it's the first physician-led and supervised yoga center, correct? This is big.
That's correct. In Miami.
Tell me a little bit about how you decided to shift your focus on that and create that. It's again, thank you so much for being on because I know that you're very busy, so we appreciate that.
Sure. It's my pleasure. So like many people, when I was a child, I was diagnosed with scoliosis. And it was never really a problem until I had my first desk job in New York City in my previous career 20 years ago.
Mm-hmm.
And it was that at that point that I developed such severe low back pain that I had to stop all of my activities and couldn't walk my dog. And I did all the right things. I went to the PT, I went to all the treatments, I saw the orthopedist, neurologist, I saw the best doctors ever, and the only thing that they could give me was temporary relief. And it wasn't until I combined chiropractic care with an active yoga practice that even now, 20 years later, I'm at my highest, most pain-free functioning ever.
That's incredible. Now, was this something that once you figured out this dynamic and this combination worked for you, was this something that you had to keep doing throughout your life? I mean, do you still do it today?
I love that question because the answer is yes. I still have scoliosis, and you can't tell, and my patients can't tell,
Right.
but it's because that I have implemented these basic preventative self-care lifestyle activities that I'm able to keep rebalancing my body and make sure that one side is not collapsing and falling apart.
Absolutely. Okay, so then explain how when someone comes in, they do a yoga class or even like separately, right? A yoga class or a chiropractor, they go to the chiropractor to get their back stretched or what or aligned. You're combining both. So how do you do that? How does that function work? And how does someone go see someone that's specialized in a physician-led yoga program?
Right. So in this specific clinic scenario, I act as the quarterback in the practice. So when patients are referred into the practice, they spend
Mhm.
about an hour with me, and I'm the one that takes the history, and then I do an orthopedic and neurological exam, and I'm the one that comes up with the final diagnosis. And then I help to manage not just the chiropractic care and PT, but all the other practitioners here, which includes trigger point therapy, posture exercise, yoga therapy, class 4 laser, and we have all of these wonderful modalities that we can combine together on the same patient so we can take a multifactorial approach to treating pain.
So then every treatment plan is individualized, correct?
Absolutely. Because while you can have the same diagnostic condition, I've never met two people who are exactly alike. So why would I give people a blanket treatment for their unique situation?
Absolutely. Do you find that that sometimes is an issue with patients that come and see you, whereas it's like, well, this is your back pain, or this is your neck pain, or you have the scoliosis, and but this is what I've been doing, doc, and this is what I've been told to do.
Yes. So not surprisingly, I absorb a lot of frustrated patients or people who are at the end of the road because we're not in-network insurance providers. So people go to all of the in-network doing the right thing. They want to use their insurance. They go to all the things that are available through their insurance.
Right.
And by the time they end up here, they've told, well, this is just how things are. This is part of getting older. This is a permanent condition you have to learn how to manage. And all of that is trash. It's totally untrue.
Wow. I mean, that must be like a nice little wake up call for someone. Probably feels like that there's no other resources to check out.
Yeah. I mean, I hope so, because
Yeah.
even almost 16 years later, it is fun for me to go to work every day because I know that people in whatever increments are absolutely going to get better.
Absolutely. And you know what? I could sit here probably talking about back pain and neck pain, but we're talking about TMJ today.
Right.
So, which
Yeah.
I think is really interesting. All right. So, as a chiropractor, does someone who has TMJ see this whole time? I'm thinking, if you have TMJ, you're going to your dentist. You're going to,
Yes.
right? So, but here, no, you're actually going to see a chiropractor too for your TMJ because, yes, it's your joints and your muscles. So, what is TMJ to begin with, and why am I coming to you?
So the first stop should be your dentist or your
Right.
dental provider. Why? Because they're going to do a thorough exam and catch things that are not necessarily coming just from tightness here in the joint. And very importantly, at a minimum, they have to get you one of those mouth guards to protect the surface of your teeth so you don't grind them down.
Mm-hmm.
But that being said, if you're tired of the anti-inflammatories, the Botox injections, or being told that it's all in your head because you're grinding your teeth at night as if you have any control over your stress and grinding your teeth, um, part of the core education that we get in chiropractic school is not just spine, but treating all the joints in the body.
Right.
And a joint is a place where any two bones meet, and that includes your jaw as well, where the temporal bone meets the mandible, and you get the temporomandibular joint. There's a little
Right here.
cartilage disc, yes. And we need this, we need it for a little bit of
Yep.
everything to function normally.
Yeah.
Inside there, there is a little slipping cartilage disc. You can think of it as a little piece of ear or meniscus or spine disc, and that has to be able to slip in and out easily. So where this becomes the chiropractic issue, or why you can see your chiropractor sometimes, is we are treating neck pain, and we're treating neck pain, we're treating headaches,
Right.
sometimes shoulder pain, and then a close best friend and another tension holder is the
Yes.
jaw. So what happens in my clinic is that people come in with headaches and neck pain and shoulder pain, and then they'll go, and also I have TMD, temporomandibular disorder. I have tightness in the jaw. I have locking. I have clicking. Is there anything you can do?
And then you say yes.
Ab- Absolutely, because there's not a lot of mysteries when it comes to orthopedic care or,
Absolutely.
or joint and muscle care.
So you talked about it's so interesting, and if you're so all those things are so tied together when you have headaches and you have neck pain, and all this can be connected to this. Then how does it tie into like misalignment as well, especially when it comes to posture? Is that also tied into that?
Absolutely. So the best way that I can describe it, especially
Yes.
as a horse person,
Okay.
is we have these beautiful strappy muscles here on the side of the neck that connect up into the head and the jaw.
Right.
And what can happen over time with everybody is when you're sitting in front of your computer and working on your cell phone, it's
Oh,
everybody. The only way I can compare it, if you've ever seen a horse with a rein in its mouth, all of these muscles, including the muscles here in the jaw, are getting pulled like this all the time. Every time your head is off of the vertical center line, off of the y-axis,
yes.
you're causing pressure and tension and compression on pretty much everything, and that includes
Wow.
your jaw as well.
So that's basically pulling on your back and your neck and all this that affects your yes.
At all times. And then on top of that, and this is where I think that the nighttime grinding comes in when they say, oh, you're so stressed, you're grinding when you're sleeping. We have these beautiful little sensors in all of the joints in our body. They're called proprioceptors, and
Mhm.
they give an idea of where our body is in space. If your jaw is not in its proper shock absorbing gravity position and it's constantly out, you're gonna start grinding at night because your jaw is trying to figure out where is this head supposed to be. I would need to get you back. I need to get you back there.
Yes. I do that grinding at night. And I realize that and sometimes I don't realize I do it, but I have woken up in the middle of the night where I grind. And then I wake up with that pain
Yeah.
right here. And then
Yeah.
I see how you're explaining it. And I'm like, oh, wow, it really does. Cause then you're just like, your head hurts and everything hurts because you've just been doing this and it hurts every piece of joint and like muscle.
Everything. Body, the body is smart. It's not stupid.
Yes.
So even when you're sleeping, these little joint sensors are like, I'm just not sure where I've been all day.
Right.
Can we figure out where do you belong? Are you here? Do you belong here over a cell phone and a computer all day?
No,
I
no.
don't know. I'm gonna try to find out. And then your jaw muscles end up working all night.
So would you say that then TMJ and that pain or what causes all that misalignment, is that all tied to stress or is that tied to aging or
So,
injury?
so aging, I mean, aging is not supposed to be painful. So we'll go back to stress, right? Because
Okay.
I hate that, especially with healthy young people, most of whom I'm dealing with. I hate when people say, "Oh, you're getting older." I'm like, that means I don't know. So let's
You're like, no, that's not the
no, it's
excuse.
wrong. It's wrong. So let's go back to the first question you asked, which is this stress? The answer is yes. There are three types of stress that make people unwell: physical, chemical, and emotional stress. So we'll go back to two different types of stress that
Right,
are very easy to control with TMJ. Number one, physical stress. This is physically stressful.
right,
Your body doesn't like it. It doesn't like sitting. It doesn't like cell phone. Doesn't like. It doesn't like being pulled on all day. And then emotional stress, not surprisingly, things have gotten stressful in the world. And without an outlet that suits you, you can hold and clench your jaw. I always say that people carry the weight of the world in their shoulders, and this is the cell phone region of the body. And so there's many different ways that you can relieve the physical stress as well as the emotional stress that can accumulate into the jaw.
right.
Obviously, I find chiropractic care to be an excellent stress reliever for the spine and the joints. And then having a yoga center, I think that having a good yoga practice and different meditation options is good for relieving emotional stress.
So then let's talk about some of those practices because now you have a patient that came in, says, Doc, I'm so stressed. We located what the issue is, and now we have a treatment plan. So what does a treatment plan look like? As we said, yes, everything's individualized, but what does, let's say, a typical treatment plan look for someone who is experiencing this kind of pain?
So if someone has TMJ pain and they are already under a care of a dental professional, because I do think the night guard is important, what it's going to look like in my clinic is number one, most importantly, we're going to rule out anything that's dangerous, red flags, pinched nerves, anything else that might be causing jaw pain that has nothing to do with the jaw.
Right.
Second will be a postural assessment and starting to work on the mobility and stability of their spine. For all of those angry little trigger points that have accumulated inside the mouth, we put on the blue gloves and we go inside and we do manual trigger point therapy.
Wow.
To, yeah, it's tender. Like it's tender.
Okay.
It's tender but therapeutic.
Yes. Yes.
And we do intraoral work to relieve the trigger points that have
Right.
accumulated inside the jaw as well as into the neck. And then my favorite for pain control, which is a class 4 laser that we can use over the joint. I call it the alternative for a cortisone injection. What it does is we send in 4 different color and size wavelengths of light that go deep into the joint, and it not only helps to stop pain, but it improves circulation. So it also helps to heal dysfunction in the joint.
So how many of those sessions do you need, like where your tender therapy and then the laser? Does a patient usually do like a course of certain treatments? Is this lifelong? Is this, hey, let's see how it gets, and then we can see if it works, and we have to move on to something else?
So I typically won't accept the third patient because I will not take a patient here if I don't think they're going to get better.
Okay.
So I would say, so a typical treatment plan would look like if it's Someone who hasn't had jaw pain for very long and they haven't failed in all of the more invasive or pharmaceutical treatments, I would say it would be 6 to 8 sessions, because a
Okay.
big piece of that is also structural work and restoring a lot of the posture muscle. And then the second piece is, yes, you have to take care of this forever. Even if it's not with us, we give you a home care program to make sure that you're doing things to perpetually prevent the accumulated stress that goes into the jaw.
My question is too, at what point does a patient come in? I mean, listen, and I think women especially, you wake up and you're like, oh my gosh, this hurts, or I've had this pain for a couple of months, but we don't necessarily get it checked out because we think, I was grinding, or it will go away on its own. At what point
Yeah.
should a patient say, hey, I think I need to go see someone?
Yeah. So I call it walk it off pain versus I need to find out what's going on pain. Walk it off pain
Yes,
is I worked out really hard this morning and then my muscles are sore for the next 1 to 2 days.
right.
Walk it off pain could be I played tennis too hard and I pulled something, but I'm going to do my normal stretches and it goes away. This, when you have chronic pain over a long period of time, especially in an area that you did not exercise, that's a bone grinding on bone. That's a joint that needs to get checked out, have a proper diagnosis. Because as we find out, as we get older, when the bones start to grind together and become arthritic, they want to replace them, but we want to keep
Right.
our original parts.
Let's talk about your program, Dr. Donan. So the guide to working with injuries. So this incorporates a lot of posture correction for the TMJ.
Yes.
We talk a little bit about that. How, I mean, do you say to your patients, you will see relief with my program?
Yes,
Like,
absolutely.
okay, okay. I mean, obviously, a lot of patients may come in skeptical, and it feels like you really just have the magic sauce. And I mean, it feels probably fantastic, but how much of that also includes the patient having being educated and doing the work to be able to find that relief as well with the
Yeah,
help of your program?
the patient is the one who gets themselves better. The patient is the one who gets themselves better. We can do, and this could be in any office, you can do great treatments. And if the patient is not compliant with the treatment frequency or doesn't do the at home exercises, any treatment in any office is temporary. Because
That's a
because
great
these
point.
are these are lifestyle oriented. It's not a car accident. It's not getting pounded on the football field. It's not a trauma. Most of what we're treating today in orthopedics, or in this case, the jaw, are chronic lifestyle grind
Right,
downs, right?
right.
So I think as a provider, outside of a good diagnosis, we want to create the proper treatment plan to address the pain, but also prevent the issues in the future. And those issues are at home. And that's the best place to give people these
You're
tools.
absolutely right. Now, let's talk about before, because I did want to ask about athletes, but preventative. If you want to kind of nip this in the bud and not have a situation like this, because obviously it can happen to any of us, what are some preventative techniques or tools that we need in order to avoid that kind of pain, or sort of navigate that stress where it doesn't affect our joints?
Sure. So the best program that any of you can do at home is called foundation training.
Okay.
And you can go onto YouTube, you can look up their original 12-minute video, but they have hundreds of videos online. And all of it is meant to be easy, safe, and geared towards resisting the inevitable compression of gravity on our posture and our entire joint system. It is easy. It is designed by another chiropractor, Dr. Eric Goodman, and it is the secret sleeper hit in orthopedic rehab. It's called foundation training,
Foundation
and
training.
you just do it. That's the secret sauce. Is there's an excellent program. If you do it every day, you can always do it with a certified instructor like
Right.
myself. It's going to help you resist a lot of the postural orthopedic issues that many of us are treating. And then the second thing, which I love, not surprisingly, is yoga, because yoga will gently bend and breathe and twist and stretch you in weird ways that you would never otherwise stretch. So I am in favor of going to find a gentle yoga class, a restorative yoga, or anything that's going to get you out of your hunched
Right.
position that you keep all day.
And with your like your combination therapy of, as I said, medicine, but also the yoga, you recommend yoga for all your patients who are having, whether it's neck pain, low back pain, in general.
I do with an asterisk on it because
Okay.
yoga is like food. There's many different kinds, many different teachers. So I think it is important, and that's why I have that program, Dr. Doman's Guide to Working with Injuries, where I train yoga teachers how to accommodate and work with orthopedic injuries.
Interesting.
Because what's good for somebody with a herniated disc in their low back is not going to be good for somebody with low back stenosis, is not going to be good for somebody with a different type of shoulder issue.
Right.
So I think it's important to find a well-trained yoga teacher or work at a gentle and slow level so that you're not creating more issues rather than helping.
How does that change for you when you're working with elite athletes? I want to start with elite athletes, but I also think as you mentioned, you see a lot of young patients as well.
I
And I'm
do.
sure a lot of these young patients are also budding athletes who will, whether they're teenagers, college age, but they are going to deal with injury as well. So then how does that treatment approach change when you have elite athletes, whether it's back pain, TMJ? Is it a combination of both modalities?
So the only difference between my pros and my amateurs and other young patients is the frequency of the treatments. Hold on, let's see what this is.
I think you did a thumbs up and it
Oh,
automatically just like sends
okay. Ah, that's so cool.
it's
Okay,
very
so
positive. It's very positive.
ah, cool. So the only difference is the frequency and intensity of the treatments. My pros and my amateurs get exactly the same treatments here, but with pro athletes, their entire career is whether or not they are healthy and have the ability to play. So they might be here 5 days a week if they're unwell
Right.
or if they have an injury. Whereas an amateur or a local golfer or a tennis player, they're going to come in 2 days a week to do it. I would say the second thing is attitude and follow through because that's what athletes know how to do.
Absolutely. Now, I know this will probably range, the answer will range, but when you have, whether it's an amateur or an athlete, or maybe it's someone like myself that goes in, does everyone bounce back at different times? How soon can you go back to doing your activities? I think that's a big question when you're dealing with someone who has pain and they're like, can I go do my yoga class? Can I go for a run? Can I play pickleball? What can I do?
So the answer is it depends on the severity of the
Mm-hmm.
injury. But I think rest is usually, it depends on the injury. It's one of the worst things you can
Right.
do, because then your whole body starts to decondition and your mood starts to go. So, for example, I have a shoulder labrum patient coming in soon. So, can she do push-ups and lift overhead? No, but can she exercise the entire rest of her body so that she doesn't lose conditioning from head to toe? Absolutely. So, a lot of it with the amateurs is about modification and not
Right.
totally stepping out of sport.
And you and as a physician as well, it's important to keep the rest of your body moving.
Absolutely, for two reasons. You don't want to decondition from head to toe. It takes forever to build muscle and about 3 seconds to lose it. And then neurologically, if you do have one injured side and you exercise the non-injured side, there is neurological crossover
Right.
to help heal the injured side faster.
Interesting. I want to go back to one thing that you said early on, and one of the big things that for TMJ, I'm giving you from my experience, which happened a couple of weeks ago, which is obviously you mentioned the night guard, but you mentioned it as well, the treatment of Botox to relax those muscles. So what is that a treatment as opposed to taking a pill? What does the Botox do for patients or those who are watching that don't know?
So, and I don't administer it,
Right.
so I will speak on behalf of what I know of Botox, which is that it paralyzes the
Mhm.
muscle. So if you have an overactive muscle here and they have tried everything else, they're like, well, let's paralyze it and see if that helps, and then maybe you'll stop using it as much.
Right.
Again, from my perspective, why did you use it too much in the
Right.
first place? I think it's important to take a root cause approach
Yes.
to issues so we don't see what I have seen in practice, which is I go for jaw Botox injections 3 times per year, and I'm tired of going because it's been so many years. What else you got?
Right. Right. Absolutely. Okay. So as we wrap, that's one thing I want to leave our viewers with is I think this is really eye-opening because as we mentioned, you just think, oh, I'm going to the dentist. The dentist told me I have this. Now what's the next follow-up? And I don't think many understand that your next follow-up would probably go see a chiropractor. So what are some like last minute advice that you can give patients or anyone who's watching this if they have that pain?
So if they have that pain and they're in a different city, this is the order of
Yeah.
operations. Number one, go do the least expensive and most accessible option, which is go to foundation training. I'm sorry. Go to foundation
Right.
training and start doing those postural exercises so you can start to address your posture for free at home because all roads lead to muscle
Right.
and
Oh,
self-care. And then the second piece, if you are symptomatic, I would find a chiropractor in your city who's trained in all of the sports modalities, which is outside of a spinal adjustment, we have a lot of the soft tissue therapies that can help to address the soft tissue component of the jaw pain as well.
absolutely. And what if someone wants to come go to your practice?
So I'm located in Aventura, Florida, and we're right here on 175th in Biscayne. You're always welcome to come in here. You can visit us at YogaDoc or Miami Sports Chiropractic and Yoga. And the first visit takes about an hour, and we'll get somebody out of here between 6, 8, 10 visits if they follow through on the treatment protocols. And we have a good time here because people are getting better.
Absolutely, Dr. Doman. Thank you so much for taking the time out. This has been such a fascinating conversation. I love that we talked about this because I, for one, did not know you see a chiropractor for if you had some TMJ. So thank you for that. And thank you for having us on, I mean, thank you for being on the Health Channel.
You got it. Thank you for having me today. Take care.
Bye-bye.